The content provided in this podcast is for informational purposes only and is not intended for a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your doctor or other qualified health professionals with any questions you may have regarding your medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
On today's episode, we will be talking about the emotional challenges that people with type 1 diabetes face and ways to help overcome hard times. We're your hosts, Isabella McGee and Sebastian Harris.
This is Life on the Level. If you're listening, you probably have or know someone with type 1 diabetes. We're here to give you the knowledge and encouragement so you can thrive. Join us as we dive into all things type 1, real experiences, expert insights, and practical strategies.
We know diabetes can be hard on your health. There's a lot of things to be wary of outside of just the immediate needing to inject or look at my insulin or counting carbs. There is a much deeper and often more hidden condition to an already hidden condition. And that is your things like your emotional well-being.
Stats from Diabetes Australia show approximately 1 in 4 people will experience depression sometime in their adult life. For people with diabetes, this figure is even higher. And up to 50% of people with diabetes are thought to have a mental illness such as depression or anxiety.
Some of these things with depression and anxiety, I know that I can speak from experience of how anxious I've been in situations like that.
It's hard not to be.
Yeah, and one of the ones, for example, for me, is the immediate things is needles. Like, I hate needles.
Yeah,
So,
yuck. And blood.
Yeah.
I hate blood.
Yeah, you
Yuck.
gotta see a lot of it every day to day.
Yeah.
It's ironic that someone with diabetes has a fear of needles because that's how you survive.
Yeah, that was my biggest fear before I was diagnosed. Needles.
Yeah, and then the other thing as well is as a result of some of these things, like you hear these stories of like, I was told growing up that if you throw up 3 times, you're at the hospital.
If you have diabetes, yeah, right.
Because that's a concern that it might be DKA, which is diabetes ketoacidosis, which is an interesting story to get into. But I have this fear of vomiting, so I'm thinking, even if I have nothing related to diabetes, like I might just have a food bug or food poisoning or just be unwell, that if I do, I'm like, oh no, what's going to happen? What's wrong with me? I'm really nervous.
It's been like ingrained into you.
Yeah. And it's like the constant thing of like, I then force myself sometimes when I'm really stressed or anxious to not eat a lot because as a result, I begin to then worry what happens if I do throw up. So I kind of give myself less help because of these situations around this anxiety and stuff like that.
I feel like dealing with a chronic illness is hard enough as it is. It definitely does also come with a mental toll that is not always spoken about, I think. And like mental health, the impact of type 1 diabetes, you can't always see it, right? And the amount of physical and mental just absolute exhaustion that comes with acting as your own vital organ is unexplainable, unless you also have type 1 diabetes, so you would understand. But, you know, some days you just need a break and you just want to clock off, but acting as your own vital organ isn't a 9 to 5 job. It's not a on-off, clock on-off. You can't do that. You don't have that opportunity.
Yeah, and I know a lot of people kind of throw around this line of like, it's a life or death situation. But unfortunately, with diabetes, if you don't manage it properly, it can become a life or death situation.
Yeah, it is.
And it's very difficult because there's also this idea that not only do you have to struggle with that, but then there's this stigma. Like you'll see throughout this entire podcast, there's a big focus on this stigma surrounding diabetes. And we often have this idea of mental health being something that's like, oh, it's whatever. You have diabetes, surely that's a bigger focus.
There's a stigma on both of them.
Yeah. You will go to a appointment to see a diabetic specialist at a hospital, and the focus will always be on what's your bloods, what's your carbs, doing this. It's often overlooked where they just ask, how are you feeling? Are you struggling with this? It's often just like a, here's the facts, da-da-da-da. It's never actually taking the time to go, how are you feeling? Like, is this taking a toll on you? Can we get you some help? It's just that need of like making it more known. So it's no longer a stigma at all, but it's just something that is just recognized as being part of the condition as well. Not just to us as people with diabetes, but also just as the wider audience as well.
I think with mental health, regarding stigma, people only really know what they've experienced. And the only thing you can really do is educate people and remain aware that going through mental health struggles does not mean that you're a bad person, or it doesn't mean that you've done something wrong, or it doesn't mean you're less than anyone else. Same thing with having type 1 diabetes. It doesn't make you any of those things, but it's very easy to box yourself into those labels when there's the stigma that we see. And I guess all you can do when you're going through a hard time is just go through it, go straight through it.
Although we've mentioned some statistics about just the mental condition in general, there's some interesting stats from T1 International that discuss some of the main conditions about this to truly understand and grasp how big of an issue this is and not just something to kind of fob off. The first thing is, in this survey of people with diabetes, over half, 55% of respondents reported they experienced burnout much or all of the time. And 1 in 7, 14% of these consider diabetes burnout as an ongoing condition that is always present in their life. Constant burnout.
Yeah, wow.
It's scary. And I mean, it gets much worse. Over half of respondents, 57%, reported a strong or overwhelming impact that takes the form of lack of sleep, feelings of depression and anxiety, and neglect of blood glucose management.
And the lack of sleep, it's like, how do you deal with that when you also get lack of sleep from dealing with your blood sugars all night? It's like you're constantly battling between dealing with diabetes and then dealing with other stuff going on as well. And it's no wonder that people have these struggles and then they're really in a position where they feel they can't do anything about it.
Yeah, and they're stuck in a gap where they can't get out.
It's a whole loop.
Yeah. A staggering number of people with diabetes, 62%, are not seeking any support from friends, family, or mental health professionals. And less than a quarter, 24%, claimed they feel comfortable talking with their own doctor about this burnout. I mean, these are like...
That makes sense to me because I think, like I'd said, unless you understand having type 1 diabetes, I personally am not going to vent about my illness to someone who doesn't get it. So it's hard to find people who you, 1, relate to, 2, have that connection with, and 3, also understand what you're going through. They're not great stats, but it doesn't surprise me that that is the number.
Yeah. So it's that idea of breaking down what it actually is, and all the stats aside, the fact that people don't feel comfortable enough talking to someone about, people struggle to talk about their mental health with anyone in general.
Yeah.
It's really scary to think
there's another thing on top of it.
As part of it, it's like you're still not talking about it. So then you have 2 issues which then build up and some really quite horrible niche stuff can happen.
Yeah. And I guess something that's helped me when I'm personally dealing with the inevitable diabetes burnout, because I experience it as well, I think we all do, is having a good support network. And although these people might not necessarily understand the illness as someone with the illness, they have seen it secondhand from what I've experienced, and they understand enough to a degree where I can open up to them and they're able to assist me. So I find it helpful sometimes if I'm feeling super overwhelmed with life, as people do, and I'm very stressed, if I've got a packed schedule that day and then I find I need more insulin, that sometimes will just top me.
Yeah.
Because I'm like, I have to go get this now and I do not have the time and I need to go get it. So I have to change my schedule to get it. So I sometimes find it useful to have people around that could assist you with that, like go get your medications for you, or even help you with your site change, or help get it prepared, or get jelly beans for you if you've run out or something like that. I find those sorts of little, even though they think it's little tasks, for me they're everyday tasks that take up a lot of time and a lot of mental energy and distract me from doing other things that I want to be doing.
Yeah. So it's like a boiling kettle kind of thing. It's like you have all this stuff that's building underneath and then all of a sudden the lid just opens up and all of this stress.
And then you're like, why me? It's not fair that I have to deal with this as well. And
And then when we're talking about this diabetes burnout, it's just the idea that you get to a point where you're just so fed up with things. You go, I don't want to do this anymore with my diabetes. I'm like, why is it me? This like,
let's stop.
Should I really do stuff like that? And it just wears a toll. And
you can't though. Like you can't stop. And I think that's the hardest part, because you're trying to look after your mental health by taking a break, but you can't take a break because then you're jeopardizing your physical health.
Yeah.
And I really don't think people understand how much of a mental burden having a chronic illness is, especially when it's invisible and especially when a lot of the things that you deal with, you don't see.
Yeah. The best piece of advice that I have got in relation to this is just vocalize it. One of the things that I do, which is probably quite bad for me, is I tend to internalize a lot of the stuff. So I kind of think
you seem like that type.
Yep.
Yes.
You kind of just let it dwell in your head and you never really get it out of your system, and it's just there. And it's like having someone who can empathize with you or someone who just has a condition like you really helps you understand that it's not just you.
So not like someone whose grandmother's cat's cousin had it?
No,
okay.
No. Or someone who has some other condition that's completely unrelated.
Right.
So it's making sure that you can talk to someone who really is willing to help you as well.
Yeah, and understand and want to listen to you. Yeah.
Yeah, so making it vocal is something that I think is really important, because then you can kind of let the boiling come down and down and down and down, and then you kind of just give yourself that opportunity to go, okay, I'm feeling like this, but what is the best thing I can do to help manage that? So just make it known to someone and just sit down and have a conversation. It doesn't have to be anything fancy. It can just be like, go out with a friend for coffee.
Yeah.
Or just sit down with a family friend.
Scream into a pillow if you have to.
Yeah.
If you don't want to talk, if you're like Seb and you don't like talking, scream into a pillow.
Or the other thing is, you don't even have to, if this is more like you, even just literally saying it out loud, even just knowing that, it just kind of...
Yeah, writing it down, journaling. Yeah.
Just kind of visualize what it actually is, rather than... Because I think we often also like to overestimate a lot of things. We tend to magnify things a bit more than it needs to be. And this whole thing of, if we just take it back a bit and just think, okay, I'm here, I feel like this. How can I help?
Yeah, I think another thing is to take time for yourself and to do the things that you enjoy doing. And whether that be drawing or walking the dog. I love to walk my little dog, Henry.
Oh,
He's a good little distraction for me. He makes me very happy. Just distract yourself. I feel like just keep your mind busy.
Yeah.
And just try not to dwell on things. And I know it's hard, and I know that there are times where you go, yeah, I'm still going to dwell on it. That doesn't help me. Of course you're going to have those times, but also sitting in those times and accepting them and just being in the emotion and experiencing the emotion and understanding where it comes from and why you're feeling that way. It's okay to be like that, because yeah, we will get burnt out. We don't have anyone else who wants your job as a pancreas right now. So sorry, your position is not being taken by anyone else.
Yeah, and although it's important to think over it, it's important not to dwell on it and get yourself in a deeper hole than you need to be. So seek help if you feel you need it.
Yeah, and some signs it could be time to reach out to someone, whether it's a friend or a psychologist or anyone in between. Maybe if you're feeling overwhelmed or sick of managing your diabetes, if you are avoiding looking after your diabetes, have regular low moods or anxiety, are struggling with self-confidence or self-worth, or are going through a major life change or stressful situation.
And the thing is, it doesn't have to be super major to reach out and get help.
Yeah.
If you or someone you know is having a hard time and need someone to talk to, you can call Lifeline on 13 11 14 or speak to the NDSS hotline on 1-800 637 700, or you could check the show notes for some more helpful links. But just know, reaching out is not a death sentence, it's not a label, it's you just asking for help. Or speak to the NDSS helpline. As we wrap up another episode of Life on the Level, we want to thank you for being part of the supportive community. Your stories, questions, and just being here fuel our mission to offer meaningful support and education to people living with diabetes. Keep the conversation going, stay connected, and remember, together, we're stronger. Don't forget to follow the show to hear more wherever you listen to your podcasts.
This podcast is brought to you by the National Diabetes Services Scheme. The NDSS is an initiative of the Australian Government and is administered by Diabetes Australia.
Diabetes Australia acknowledges Aboriginal and Torres Strait Islander peoples as the traditional owners and custodians of this country. We pay the utmost respect to them, their cultures, and to their elders, past and present. We extend that respect to the Aboriginal and Torres Strait Islander people here today. Diabetes Australia is committed to improving health outcomes for all Aboriginal and Torres Strait Islander people affected by diabetes and those at risk.
All experiences and opinions described in this podcast are those of each individual guest. Your experience and management may be different.